Hello, friends. Welcome to A Little View podcast, the podcast where the perspective may be small, but the conversations are anything but small. I'm Gwen, your podcast host, a soon-to-be dietitian, a health coach, and an advocate. This is a podcast where we talk about things that aren't talked about. We're the voice for the unrepresented. We're having empowering conversations about healing your mind, body, and soul. And we're bringing on guests to share their inspiring stories. This is A Little View podcast. And I just want to say a little disclaimer that this podcast is for educational purposes only. It is not medical advice. Always talk to your doctor about your own health journey first. And in today's episode for March Nutrition Month, I am talking with a clinical dietitian, Renee Gawel. Renee has over 30 years of experience and specializes in critical care nutrition and tube feeding in the ICU. In this conversation, we talk about what ICU dietitians actually do, plant-based nutrition, and why advocacy is so important for our patients. And as you know, just like last episode, March is Nutrition Month, and each week I will be bringing on a new dietitian to share their perspective and their story. Today we have Renee on the podcast. She is a dietitian and she specializes in tube feeding and critical illnesses, which again is so fascinating. So before we get more into the topic, I would love for Renee just to introduce herself a little and just talk about who she is.
My name is Renee Gawel, and I have been a dietitian now about 33 years. I went to Central Michigan University and got my degree in dietetics, and I started working, did my internship and whatnot, and I started working at the WIC program. Did that for several years, stopped to work a little part-time, raise some children, and then it was time to get back into the workforce. And so I jumped back into the clinical nutrition field, and that has been something that I've been doing now for the last 20 plus years.
And before we dive into your career aspect, what do you like to do outside of work?
Outside of work, I love to be active, doing a variety of things like yoga, walking, lifting weights, cooking. I'm really into plant-based nutrition, so I love trying new recipes. I love animals, and I volunteer with the Michigan Humane Society, and I walk the adoptable dogs.
That's so awesome, giving back like that, helping animals that obviously probably don't get out that much. So being able to do that for them and give them a little love.
Absolutely.
So after you graduated, did you just jump right into your job?
Well, back at that time, we did not need a graduate degree,
Okay.
but we had to do an internship.
Okay.
So I did my internship through Oakland County Health Division. At that time, it was a community-based intern program. It no longer exists, but I worked for Oakland County in several roles. And then when that was, I actually did my internship part-time. And the other part-time work I did was through the WIC program, the Women, Infants, and Children program.
And what did you do for them?
Well, because I wasn't a dietitian yet, I was something called an auxiliary health worker. So I weighed and measured children. I poked their fingers to check their hemoglobin level. And then that information is used to generate kind of a nutrition risk to ensure that the child qualifies to continue with WIC services.
Hello, guys. Just me editing this right now. And I just wanted to pause and explain something for those who don't know. If you are unsure of what WIC is a program that provides healthy food, nutritional education, breastfeeding support, and healthcare referrals to low-income pregnant women, postpartum, and breastfeeding women, and as well their infants and children under 5.
So, and then as I progressed through my internship, I started working as an actual dietitian and doing nutrition counseling for families that were part of the WIC program.
So you stayed at WIC from being your internship, and then you just stayed there right after your internship?
I did, yeah. Yep. And I worked there for 10 plus years on and off, probably a total of almost 15 years.
And how did you like doing that?
I loved it at first, but it got to be difficult for me seeing people struggle, seeing people maybe raise their children in ways that I didn't fully agree with.
Yeah.
And so, but the positive side was I learned a tremendous amount about feeding babies, feeding young
Yeah.
children, how to take care of my own pregnancies, how to eat properly to breastfeed my babies. So that was a very kind of a win-win situation. I was helping people, but also learning right along other mothers as I was a young mother.
Did you remember a lot of the stuff you learned in school?
I did for pregnancy and children, but there was
Okay.
a learning curve for how to feed infants. That
Okay.
was something I learned on the job,
Okay.
listening to other dietitians,
Mhm.
studying. I
Yeah.
think the field of dietetics, you have a general understanding of the life cycle. But if you're
Mhm.
going to work in a specific field, you want to have motivation and a little bit of a dedication to learning specifically what the people you're going to be talking to are dealing with. So I had to learn about infant nutrition. I knew nothing about breastfeeding.
Yeah.
So those were things that I found interesting, and there were plenty of resources available. Wherever I've worked, there's always been educational opportunities to learn and like improve your craft.
Yeah, I feel like so many times I've thought like, "Oh gosh, am I just supposed to jump out of school and know this?" But it feels really reassuring knowing that you're also still gonna get obviously education on the job, but then
Yeah,
you're gonna do more education yourself to figure out these things. Like you're not just gonna be thrown in and automatically expect like, "Okay, Renee, you know how to
exactly.
do this."
And it takes a little determination, but I think if you're in dietetics for the right reason, there's a compassion side to
Yeah.
helping people, right? Any
Mhm.
healthcare field. So that motivates you to want to put yourself in your patient or your client's shoes because you want to be genuine, right? And a little of it comes back to, my personal blessings, having
Yeah.
not struggling as a child, having enough food to eat,
Yeah.
having enough money to eat properly,
Yeah.
there's a little bit of that I think that is involved in healthcare.
For sure. And would you say during the time you were in at WIC, there was a moment where you were like, "Okay, I did this job for the right reason. Like this is my calling."
Yeah, I think at first it was financially based, right? Like I need a job. And then
Yeah.
as the more I worked, I was like, yeah, this feels really balanced. It felt, it was hard, I say at first, because I was talking to women about raising their children and I was not a mother. I did not have children.
Yeah.
I did not go through a pregnancy. But as time went on and I became a mom with young children, it definitely felt a lot more it synced a lot more.
Uh-huh.
I didn't feel the imposter syndrome, let's just say as much.
Yeah.
Because I think never having a baby, I definitely felt it got to a point where I was really solid with what I was doing. And then I think like any job, you just kind of especially with nutrition, there's so many avenues.
For sure.
Just like I want to try something else, I want to work on something else.
So let me understand. You're saying that you went from WIC to then hospital. What did you do after you left WIC?
After I left WIC, I took a little time off to just be a
Okay.
mom and enjoy a little a full-time mom. And then I was like, okay, I'm ready to go back to work part-time. And so honestly, my husband said, hey, here's a job at St. Joe's for a clinical dietitian. And I had been doing contingent work and I went,
Yes.
okay, let me try this. Let me get back into it. And, I think with any career, whether it's nutrition or anything else, if you keep your
Uh-huh.
mind open, opportunities present themselves and you
Yeah.
just go for it with the knowledge, with the faith, with the belief that things will fall into place as you need them to. But you got to be determined
Yeah.
to learn and do the work. So I did the work. I took the part-time job. I did what's called a job share, which is very common in clinical nutrition. So one girl worked 2 days a week. I worked 3 days a week.
Okay.
That girl, because she was having her baby.
Yeah.
And then another girl was ready to go part-time and she worked in the ICU. And I went, oh, okay, I'm going to give this a try. I can handle it. I'm going to
Yeah.
do it. Then she decided to go, when she had her second baby, she decided to go to stop working. But during
Uh-huh.
that time, I was like, I don't feel comfortable taking care of critically ill patients. I'm going to study and get my certified nutrition support certification.
Okay.
And that's where I decided to become a CNSC.
Yeah.
And so there's a very big what's called the core curriculum from Aspen. I read through
Mhm.
that. I prepared for the exam, and that really boosted my confidence. And then it was just a matter of getting used to that environment.
I like
So
how you were saying you had to start from the bottom.
yeah,
You had to be determined, start from the bottom, and then work your way up. And you obviously wanted it bad enough because you wanted to educate yourself to be able to give these patients the best you they can experience. So, was that just like a course? That wasn't another, like, schooling per se, was it?
No, it's, basically you become a member of ASPEN, which stands for the American Society for Parenteral and Enteral Nutrition,
Okay.
and they have a very large, like, 4 or 500-page book, and you read and you study. You're also what you're reading and studying are the same things that the patients you're seeing on a day-to-day basis are experiencing. So
Okay.
while you're learning, you're also doing, right?
Okay.
So and then you take the exam, and I passed the exam. I've taken it 4 times now. This was, like,
Wow.
literally, like, 20 years ago now.
Yeah.
And so but I found something that I was good at, but I was also interested in. If you're not
Yeah, for sure.
interested, you can't do the
Yeah.
work.
Yeah.
So it helps to be honest with yourself with
Mhm.
what you like to do. And that's the beauty of dietetics. You have public health, you have
Yeah.
clinical nutrition, you have sports nutrition. There are so many avenues. You have oncology. You can be specialized in oncology. You could specialize in dialysis. So you can't really get bored if you're really
Yeah.
truly interested in helping patients and learning about nutrition. Is the salary always there? Not necessarily. The salaries come a long way, but it's a livable wage.
But
If
I
it
think, like you said, I think you have to be doing this for the right reasons. Like, no one's going to dietetics for the pay. They're
right,
going to help people because they obviously find a big compassion in nutrition and they want to help people with nutrition. It's obviously not for pay.
right, right.
Now you are tube feeding. What do you do now? What is like your day to
What is
day?
my day? So I go to work, I print up my sheets of all the patients that are in ICU, and we get consulted by other professionals to say,
Mm.
hey, pay attention to this patient. This patient needs this, that, or the other thing. And then in the clinical world, you have protocols. You have malnutrition screening tools that score people who are at nutritional risk, or maybe their BMI is very low, or
Okay.
maybe they have a tremendous pressure injury. We have a lot of protocols that put patients at higher nutritional risk. And so
Mhm.
we set our day and we prioritize who we need to see for the day. So once I
Okay.
get that list going, then I head off to ICU and I round. So my ICU has a medical intensive care team and a
Mm.
surgical intensive care team. Some hospitals have 4 or 5 ICUs. The bigger institutions have, like your U of M's, your Hurley Hospital, your Corwell's, they have 4 or 5 ICUs. Where I
Okay.
work, it's just one ICU. But
Okay.
I round with the teams and I learn more about the patient and I decide, okay, who do I need to get really assertive, aggressive with the team to say this patient needs nutrition?
Yeah.
I'm constantly advocating for people who may not be able to advocate for themselves because they might be intubated on a
Mhm.
ventilator, or they've had a stroke and they can't swallow. So that's where the
Mhm.
tube feeding comes in. Patients might have a short term tube that goes in the nose. If they're on a
Mhm.
ventilator, they have a tube that goes in their mouth and attaches to the ventilator tube. But the
Yeah.
ventilator goes down the trachea, the feeding tube goes into the stomach. Or you have patients who already have a what's called a longer term tube in their stomach, surgically placed. And
Mm.
so I assess their calorie and protein needs based on their condition, and I prescribe tube feeding recommendations for them. If
So let's say a patient has a tube and let's say they were not conscious at the time. How do you know when you calculate their, let's say, calories, is it the same amount of calories you would calculate for just like me? Or not just me, but just in general,
in
as
general,
me as a reference, as a person?
correct.
Mm.
Yeah, I know what you're saying. I start with height and weight. Are
Yep.
they normal weight? Like are they like within normal limits of
Mm.
their ideal body weight? Are they
Yeah.
obese? Are they underweight? I look at that. I look at their condition. Do they have wounds? Are they malnourished?
Mhm.
Have they had a surgery where they have high protein needs because they're
Mhm.
losing fluids from some part of their body, which might have
Yeah.
protein in them. And so
Yeah.
I just base it on the patient's condition. And
Mhm.
so there's predictable equations. Some facilities have a machine that actually tells you based
Mhm.
on metabolic studies what kind of calories they need.
Yeah.
And I start there. I always tell my interns because we have interns, let's have a starting point. Not everybody needs full calories on day 1. So we start slow and we see how patients tolerate, and then we make adjustments until we get to, like, full calorie goals based on what
Okay.
we've
you have to meet them where they're at because if they're nourished, you can't just feed them the normal calories, normal, quote unquote, normal
Correct.
calories right away because a
Yeah.
lot of things will happen. Would you say?
Absolutely. There's something called refeeding syndrome where patients
Okay.
can crash. They can and we know this from the Nazi camps where
Okay.
Nazi where the Nazis completely underfed Auschwitz survivors, and they
Yeah.
were skin and bones, and some of
Mhm.
them died because they started they were starved, and they
Yeah.
started eating and eating a lot, and they were having cardiac issues. They would go into respiratory failure, and you can
Okay.
kill someone if you feed them too much too soon.
Yeah.
So, we wanna get food into people. We always wanna feed people, but we have to be disciplined to go slow and make sure patient's metabolic tolerance is met, make sure they physically can tolerate a feeding. What I see in Pontiac, I work in Pontiac, we have a lot of alcohol related admits into ICU. Patients who go into withdrawal because they come in for illness, they haven't had alcohol in a couple days, and they go into withdrawal and they
So
hallucinate.
you have to put a tube feeding in them?
We might put a tube in them because they're so out of it,
Mhm.
they can't swallow. They're already malnourished because their
Yeah.
diet is mostly alcohol.
Yeah.
So I'll put tubes in those patients. We are a stroke center where I'm at. Patients come
Okay.
in with strokes and dysphagia. After a
Okay.
couple of days, if they don't pass their swallow eval, we will put a tube in those patients. I mean, we're not putting tubes in everybody. There are
For sure.
protocols and parameters for
Okay.
putting a tube in someone. I mean, some patients might progress to never really swallowing well. They need a lot more time, and then they go on to have a long-term feeding tube surgically placed before they can get well enough to swallow again.
And sorry, I am sometimes the worst at binging all over the place. But so you stated that you write orders,
Mhm,
you do that, and then you maybe will go advocate with the other doctors because obviously they can't talk or some of your patients can't talk or represent themselves. So you are the representative. So then after that, during your day, what else do you do during your day? You said you put feeding tubes in as well, don't
mhm.
you?
Yep.
Okay.
So for my patients who are on what we call nutrition support, I
Okay.
prescribe a regimen, I prescribe a goal rate, I make sure they're
Okay.
tolerating it. And then I might see a patient I see several patients who are eating, and I
Mhm.
take a nutrition history and I find out, are you at nutrition risk? Are you malnourished? What maybe I recommend a liberalized diet, or maybe I order an oral nutrition supplement for the patient, or maybe I have to really persuade a team to really be a little more aggressive with the nutrition care of their patient. I think it's very well known that patients don't get well without nutrition, but
Mhm.
sometimes there are reasons that doctors may want to wait or hesitate. So
Okay.
that's where knowing there's a whole host of what's called feeding guidelines. There's a
Mhm.
Society for Critical Care Medicine, and they came together with the Aspen Society back in
Mhm.
2009 with feeding guidelines for feeding critically ill patients. So I revert back to those guidelines a lot and say, look, this is what the guidelines say. In the next 24 hours, we need to decide, how are we going to feed this patient? And then a lot of times I will do just straight up education. We have patients who get open heart surgery in our hospital. And part of the protocol is that they work with a dietitian after so many days after their surgery and learn about heart healthy diets and how
Mhm.
to reduce risk and how to eat better to promote all the good blood flow that they've had surgically created after their open heart surgery.
And what would you say is the most challenging thing about your job?
Convincing patients that nutrition really is important and
Yeah.
that your meal patterns, your lifestyle can make or break. I tell patients all the time, you can become closer to your health goals with every bite you take. The foods you eat, the foods you put in your mouth are bringing you closer to good well-being or taking you away from well-being. So
Yeah.
you have the decision every day with what you choose to eat. Maybe not so much meal by meal, but day by day, the patterns
Mhm.
that you establish with your eating habits, they matter.
Yeah.
And it's hard to convince people of that sometimes because, when patients are in the hospital, they don't feel well.
For sure.
And they're eating hospital food. They're sad. They have emotional issues, just had terrible things happen to them. One of the biggest challenges for me is that I'm meeting families sometimes on the worst day of their life. Their father has
Oh,
just had a cardiac arrest. Their mother just had a stroke and may not even survive their stroke. So I have
yeah.
to know when it's appropriate to talk about nutrition and when I need to just back off and the course of their illness present itself.
I think that goes back to the piece of meeting people where they're at as well.
Absolutely, absolutely. Kinda like reading the room,
Yeah,
knowing your place and knowing where to "Excuse me,"
yeah,
sometimes the team of doctors will look at me and go, "And are we feeding this patient?" Because if I'm not there in the discussion, it doesn't even come up. I can guarantee. I'll
yeah,
come back if I have a day off, I'll come back the next day.
yeah.
"Why didn't we start a tube feeding on this patient? He's on the ventilator." "I don't know." I mean, I'd
Yeah,
like to believe that's not true, but I've seen it time and time again. It's not
yeah.
breathing is more of a priority than eating sometimes, and if your patient's on a ventilator, as a pulmonologist, you wanna get them off the ventilator.
But I think people don't realize, obviously, this doesn't cure everything. People don't realize to get them off the ventilator, they need nutrition.
Right,
So they're going to need that aspect.
right.
And so, also going to the other side, what would you say is the most rewarding thing about your job?
I think helping people feel better, making sure they're getting enough to eat, knowing that I have gotten a patient fed and they are going to do better than if they were not fed. I like to say outside or nutrition that isn't exogenous is the fancy word. They're not
Yeah.
they're not breaking down their own body tissue to support their illness.
This next part is something that Renee is so passionate about, and she uses it in her everyday life and everything she does is plant-based nutrition. And actually, Renee does plant-based education, nutrition on the side. I just wanted a little more insight about this. Yeah. Well, yeah, for sure. And I also want to say, transitioning to another part, you have your own plant-based nutrition. And if I know anything of your daughter, she cooks the most delicious
Yeah.
vegan food. So if I'm sure she got that from you. So can you tell me a little bit more about your plant-based nutrition?
Yeah, sure. So we've always kind of been a little on the plant-based side in this household because my husband's been
Yeah.
a vegetarian for probably 30 plus years.
Okay.
So all along, I was cooking tofu right next to chicken and fish
Yeah.
when my kids were growing up. And I got an interest. It's kind of like my plant-based journey came to me when I went on a 3-week yoga retreat. They said, okay, while you're really dialing down and learning about this yoga experience, we want you to try to be plant-based.
Hmm.
And at first I was like, "Oh my goodness, that's a big ask, blah, 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 blah." But I was also learning about the plant-based world from physicians in the plant-based world. So my
Yeah.
2 worlds kinda came together and I'm like, "Okay, I could be a doofus or I could just try it." 3 weeks.
Yeah.
And so I went to the grocery store, I did a little field trip, I started learning. My daughter was 16 at the time. She's like, "I wanna do it with you." And I'm like, "Okay, let's do it together." It was kinda fun, we tried it.
Hmm.
And the more I did it, the more I learned. I was trying and learning at the same time about the
Yeah.
advantages. It just kind of opened itself up, and I haven't looked back in the last 10 years. I've been plant based for the last 10 years. I haven't missed a single piece of meat. Um, I use it in my work life by trying to just kind of lead people to the concept of eating more fiber, getting
Yeah.
more beans, eating a little less red meat. I don't try to convert people, but if they're open to the discussion, I tell them about the benefits. I
Yeah.
point them to the right website so they can learn for themselves. And I try to extol some of the reasons why it can be beneficial. Like one of your questions to me was, it can be controversial in the
Yeah.
dietetics profession. And I would have to say I disagree with that because the real controversy is in this notion that we need to eat meat to be healthy because there are so many reasons we don't need meat and we don't need dairy and we don't. I mean, even the American Academy of Nutrition and Dietetics has a position paper on how vegetarian and vegan diets can be very well balanced, if planned properly. The key
Hmm.
word is planned properly. Every diet can be well balanced if planned
For sure.
properly, right?
Exactly.
So I mean, there are countless articles about the benefits of going plant-based. Babies, pregnancies that are healthy, babies that can be raised in a plant-based environment. But you can't do it, like anything, you should know what you're dealing with. And that's where I
Yeah.
come in to say, here's some of the things you do need. Here's why it can benefit you. Here's why it has a threefold benefit to your body, to the animal itself, to the planet.
Yeah.
You
Yeah.
know, 70% of the antibiotics used in this country go into animals and not people because they are so poorly cared for in these big farm raised animals, like these big, I can't think of the word. It's an acronym right now. I think it escapes me, but where cows and chickens are raised on top of one another in their own stool, giving
Yeah.
antibiotics so they don't get those are in our foods. Those are in your foods. So
Yeah.
people worry about pesticides and all the other things that are in our environment. There's a lot of reasons why just focusing more on eating vegetables, getting beans, things like that. So
And
that's my soapbox.
but though, Renee, do you get all your nutrition from plant-based? Like, what happens? Do you eat enough protein?
Absolutely. Here's the thing. Do you think an elephant would get that big eating plants? Do you think
Exactly.
do you think that, cows milk is not a source of calcium because cows are magical. It's because they eat grass and they get calcium from green grass. Cows are the middleman for calcium. Okay, so there's a lot of calcium in plants, in nuts, in seeds. Yes. Do I recommend people take a vitamin B12 supplement if you're going to go full plant-based? Absolutely. That's one nutrient that we know can cause permanent neurological damage if you don't supplement if you're eating let's say a vegan diet. Do you need some extra vitamin D? Probably. Do most people living in Michigan need vitamin D?
Yes.
Probably. Yeah. So that's why I say like a well-planned diet, and that's being informed, being aware, utilizing dietetic professionals, finding
Mhm.
good websites that have reliable science-backed information.
But Renee, do you get full from this diet?
Do I get full? Do you know how much fiber I eat?
Yeah.
I mean,
Mhm.
most America so in this country, we don't have a protein deficiency, we have a fiber deficiency. Americans do not get enough fiber. The average American only gets 13 grams of fiber a day, where the goal is 25 to 30 grams a day.
Crazy.
Most plant-based eaters tend to get upwards of 60 to 70 grams a day. So
That's
actually you
crazy.
almost have to be careful, there's an adjustment period if you're going to go plant-based. If you've not had that much fiber in your diet, you might have a little
Yeah.
discomfort, you might have a little distension, you might have to work through, make sure you get enough liquids as you're increasing your fiber intake. So full is not a problem. And it's great for weight loss because you can eat a lot of food and still
Mhm.
continue to lose weight. And there are countless stories. One of my favorite websites is the Physicians Committee for Responsible Medicine, or Forks
Mhm.
Over Knives. There are countless stories of people who have reversed their chronic disease, lost weight, feel great from going plant-based. So it's not just me saying this is a good thing. There's
For sure.
plenty of research out there. And unfortunately, our dietary guidelines are misleading. The new
And
guidelines.
I just had I was just recording with an oncologist, and I asked her what are some things people can change to not obviously you can't 100% prevent cancer. It's things to lower the risk. And the biggest thing she said is people don't eat enough fiber. She was like,
Yeah,
it's very low in America. And
right.
she was like, people tout about protein, 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 but it's fiber. We should be eating more. Like,
Absolutely.
lowering your colon cancer is by eating enough fiber. It's
Yeah,
not eating more protein, it's eating enough fiber. And the diets of just meat, like they're not getting enough fiber. Like it's plants are so important. And would you say being plant-based, you've learned how to cook more? Like you've learned different recipes. Like I said, I follow your daughter on Instagram and
yeah.
it always makes me hungry. Like you would never think you'd never think this stuff is vegan. I'm like, oh my, not that I used to be vegan. I'm not saying it like that, but I'm
Uh-huh.
just saying like, oh my gosh, people that would not be vegan, they'll look at these and I would be like, oh my gosh, these are delicious.
Well, and I have read other cooks that say, look, it's not whether food needs to taste good.
Yeah.
Period. So
Yeah.
if food tastes good, most people don't care that it really doesn't have meat in it.
Yes.
Um, and I like a good challenge. I enjoy cooking. I enjoy finding really crazy ways to make food out of things that you wouldn't normally that you wouldn't make dishes out of.
Yeah.
And I'll tell you what, someone with a natural sweet tooth, when I found out that going plant-based, I didn't have to give up chocolate, I'm like, "Oh, I'm in." I'm in. Count me in. I can keep eating dark chocolate. Say no more. So it comes back to enjoying a good challenge. I really
Yeah.
love, and Anna's been very inspiring. She likes to cook. She's taught me a lot about different recipes and different ways to make things. And I think it's just fun. You know,
And what would you say being vegan, well, now being vegan and also being a dietitian, what are 3 tips you live by? 3 nutrition tips you live
yeah,
by.
yep. Well, I'm going to give you six
Okay, okay.
only because I love the book by Michael Pollan. That's a wonderful little book. Oh, it's called Food Rules. Food Rules is a fun little journey through, like, a simple thing is don't eat food made in a plant, but eat food that is a plant. Little quips like that. But for
Yeah,
me personally, I tell my patients, let's embrace tofu and beans. Avoid saturated fat and ask a dietitian for help. There's so
yeah.
many resources out there. uh, Ask a dietitian. We are the nutrition professionals. We can get you to your goals. And there are, I work at a hospital, but there's plenty of dietitians who have who you can seek out counseling for. And as the state of Michigan is now finally recognizing dietitians as a licensed professional, it took a long time. It took 30 plus years to get the state of Michigan to recognize dietitians as licensed professionals. That can only help because otherwise, people had to pay out of their pockets unless they had
Yeah.
diabetes or renal disease. Everybody
Mhm.
should have access to a dietitian.
Yep.
They should be in all doctors' offices. They should be in all clinics
Mhm.
because without that, you're missing a key component of preventative medicine.
For sure. I agree. I mean, as you know, because we've had conversations before, and obviously I've shared it on my podcast, I went through a eating disorder and not
Mhm.
being able to have a dietitian because they're not covered. You have to be like
Right.
severely, severely dying to have a
Right.
dietitian. And also the fact of me being a little person and needing more help just because I have a rare condition.
Right. Right.
Not having that is so difficult, so seeing this in is now so important.
And can I ask you, as a
Mhm.
little person, which I find so fantastic that you're representing for other little people in a field where we don't necessarily know how to calculate calorie and
Yeah.
protein needs. How much research is there out there for you to know what is best for any particular conditions that might come up? Do you find that that is lacking
I
in your
I
personal
do.
life?
I do, but I think some of it is the fact of nutrition for little people is not really any different per se. It's so stereotyped because, like, oh, we need this little amount because we're little. But, like, at the same time, we go through so many surgeries, we go
Right.
through so many things. So it's like, no, we don't need a little amount. Maybe we don't need as much, quote unquote, but I think we just need to figure out how to be full, listen to our hunger cues, like you said, eat more fiber. I
Right.
think focusing on those things, focusing on what we're eating, not how much we're eating, because I think
Okay.
so many times people are like, well, don't eat this. And it's like, well, or don't eat too much. It's like, well, no, it's more about what you're eating, not how much.
Absolutely.
Because
Absolutely.
as you know, like if you eat like a cup of beans and then if you eat a cup of fries, two totally different things and two things that will fill you up completely different. Like
Right.
you
Or
can't
not fill you up.
exactly. And like and not to say you can't, but like you don't generally overeat beans. Like you just can't. Like
Right.
you get
Exactly.
full fast. So it's like things like that. And so I think what I want to do is be the representation and like how you are with your patients, just being the represented and
Mhm.
also being the voice when they feel like they don't have one.
Right, right. Someone once said to me, "You are a patient's nutrition advocate when they can't speak for
Mm,
themselves because they're zonked or
mhm,
they're have a tube down their throat or
yeah.
they've had a stroke." And so I take that very seriously. Like I'm going to advocate for this patient because right now they can't do that for themselves. About a day's supply of glycogen in your muscles. After 24 hours, you are starting to break down your own lean body tissue to provide glucose for your brain. That's your
Mhm,
body's MO.
mhm.
Feed the brain, keep the heart, lungs, and kidneys working. So there's only so many days you can do that without nourishment, and then you'll start to have consequences.
And
Like,
just like you say that when you're not there, like sometimes the conversation doesn't even get brought up. Obviously,
Yeah.
I'm not saying every time, but sometimes that conversation doesn't even get brought up.
Right.
And for me, it's like that conversation gets brought up and the patient's like, "Oh, okay, eat less." And it's like,
Yeah.
and then I'm there to be like, "Oh, the breaks." No,
Right.
that's not what we're talking about. Like, obviously the BMI doesn't work. Obviously,
Right.
even
Right.
sometimes your patients, the BMI doesn't work. And
No.
the BMI certainly doesn't work for me.
Right.
So being able to, just like you, hopefully soon to be me, being like, hold the brakes. Like, no, we need to reassess this
Right.
because food is nourishment. So I
Right.
like your
Absolutely.
approach on a lot of these things.
Yep. 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 Yeah. I mean, I have to say, most of the people I deal with tend to be where I'm challenged trying to calculate their calories and protein tend to be obese.
Yeah.
Um, and average height, let's just say.
Yeah.
So I need people like you. I need people like you
Yeah.
to advocate. I need people like you to do research. I
Yeah.
need because I don't know. I wouldn't
Mhm.
know. And that's a deficiency of the field, I
Yeah.
will say.
And but also too is we're so little research because we're only 1 in 20,000. There's actually a dietitian in another country. She's the only one that I know that
Oh,
focuses on little people. But like just like you with your field, like you really have to dig deep. And if
yeah,
you want this, this is what you got to do to really to know your stuff to help your patients. Like
right.
you can't just go in blinded or you're not going to help them or they're going to people are gonna be able to tell if you don't know your stuff, so
Yeah, absolutely.
and so my last question, especially my last question that I'm asking all the dietitians that are on my podcast right now, is for the month of March, as you know, is Nutrition Month. What
Mhm.
does that mean to you?
I don't see the month of March as any different than any month of the year.
Okay.
To me, it's a campaign that the academy puts out to highlight education, nutrition education across the spectrum. But for
Yeah,
me, I think every month, as a dietitian, every month is Nutrition Month because I live and breathe what I do.
for sure. Yeah,
But
I
I mean,
totally
I support the academy and what they try to
yeah,
do to highlight
yeah.
the importance of good nutrition
And I also think it kinda highlights us too, because
for sure.
sometimes we're so not highlighted, but thank you so much for being on my podcast today and sharing your field and your perspective of just your sharing your perspective of just what you are as your dietitian and what your field is. So thank you again so much. I hope everyone listening got something out of it and make sure to tune in for next week and the following weeks of March to hear a new dietitian's perspective. And we hope to see you guys next time. Make sure to like, subscribe, follow for more episodes. And we'll see you guys next time. Bye.
Thank you, Gwen.